with you a little bit about reducing central line associated bloodstream infections in the pediatric intensive care unit. So the process I want to discuss is how to decrease CLABSI rates in the pediatric ICU in order to decrease healthcare costs and improve patient outcomes. So first I wanted to discuss with you a little bit about what exactly is a CLABSI. So CLABSI is an acronym for Central Line Associated Bloodstream Infection. So central lines are often needed in ICU settings such as the pediatric ICU for patients who are really sick, who need long-term delivery of therapies, and just for the safety of the patient if they need any medications very fast. So CLABSIs can be really common in ICUs because these kids are often immune compromised because they're so sick. They're in the hospital for a long time and their central lines are being accessed frequently. So with CLABSIs and in the pediatric ICU where I currently work, we've had a lot of CLABSI rates that have shown that the infection is Staphylococcus aureus, which is an organism that comes from the skin. So that's I want to dive a little bit more into that and why exactly that's happening and how we can help prevent that. So to analyze this process, I'm going to use the Six Sigma method with the DMAIC method, which is an acronym for Define, Measure, Analyze, Improve, and Control. And I hope to use this Six Sigma method to discover a possible process or improvement in the pediatric ICU in order to decrease CLABSI rates and, like we discussed, hopefully decrease healthcare costs and ultimately improve patient healthcare outcomes. So the first part is define. So to go into CLABSIs a little bit more, how exactly they affect the patient and why it matters and why we care essentially. And so we care because a CLABSI can increase the risk of death and discomfort in the patient. It can cause sepsis. It ultimately causes them to have a longer hospitalization stay, as well as unnecessary antibiotic treatment because of the CLABSI. All of this, in turn, also will increase the hospital and patient care healthcare costs. So all of these reasons are why we want to dive into this further and analyze why these CLABSI rates are so high. So the next step is measure. So our measurement goal is ultimately assessing if the PICU protocols align with Joint Commission and CDC, as well as if the nurses are adhering to these protocols and kind of collecting the data of the CLABSI rates. So current PICU protocols do align with CDC and Joint Commission, and some of those protocols and procedures are things such as sterile technique while inserting the central line or changing a dressing or accessing the line, performing hand hygiene and donning gloves before administering medications or changing IV tubing, scrubbing the hub for at least 15 seconds and allowing it to dry. Also, for dressing changes, for transparent dressings, changing the dressing every 7 days, or with gauze dressings every 2 days. And something really important in that process is scrubbing the actual insertion site with a CHG sponge for greater than 30 seconds, as well as allowing for the site to dry completely. So with that being said, I'm going to use Six Sigma mathematical equation, and Y will represent the CLABSI, and then X will represent the variations experienced, such as the various nurses that will be taking care of the patient, tools used or not used, protocols used correctly or incorrectly a number of times the line is accessed. So the next step is analyze. So in our PICU, currently, since July of 2018, we've had 10 CLABSIs. And like I said earlier, the main cause has been Staphylococcus aureus. So with this information that we have analyzed, we can see that there's, for some reason, CHG methods that are either not being adhered to or not working. So assuming that we are following all the CDC and Joint Commission protocols, and that nurses are adhering to these protocols and procedures, we just want to dive a little bit more into why we're still receiving so many CLABSI rates. So in order to assess this a little bit more, we're hoping to improve our CLABSI rates. So we can do that by collaborating with the team, discussing current policies and procedures that are implemented, and if those are sufficient, and what we want, if there's anything new possible, if there's any new processes possible. So this part's really important for everyone to be included in teamwork and making sure everyone's voice is heard. Our next one is going to be control. So this is where we take everything we've learned from the analysis, the measurements, and the improvements, and collaborating with the whole team and deciding what we want to do to hopefully improve our CLABSI rates. So this can be anything such as protocol and policy changes, improving nurse adherence and adaptability to processes and tools used. And the one that I want to focus on is new processes or a new tool that we can use in order to adhere to the CHG method and decrease CLABSI rates. So what I chose to implement is a CHG impregnated sponge disc dressing, also known as a biopatch. So the biopatch is designed to release chlorhexidine and inhibit bacterial and fungal growth for at least 7 days around the catheter insertion site. So that aligns with the 7 days that the dressing will be in place before you change it. So it's just another additional tool used to keep the CHG around the insertion site and prevent for Staphylococcus aureus from creating the CLABSI. So this is just something that not only would be beneficial to the patient in decreasing CLABSI rates and improving healthcare outcome, but also greatly decrease healthcare costs. It's a cheap implementation, as well as it's really easy for nurses to adhere, add that to the protocol, and it's hopefully the benefit will speak for itself in the implementation of the dressing. So to discuss a little bit further about the cost effectiveness, I'm going to use cost effective analysis to discuss how this is beneficial from a healthcare cost standpoint. So for discovering the net costs, I did the cost of CHG dressing implementation minus the cost of a CLABSI. So what we see here is a biopatch is about $13 each. So let's say we have 24 beds in the PICU, and these are $13 each. We change them weekly. So for every year, for those, let's say everyone has a PICU, a central line, that's about $15,000 per year in order to implement the biopatch. Now, the cost of CLABSIs, each CLABSI is $46,000, and since we had 10 CLABSIs, that's $460,000 in that year that eclampsia cost us. So as you can see here, the net cost savings would be $445,000. So that is a huge benefit to the hospital as well as our PICU. Thank you so much for listening, and just to kind of summarize, I just want to reiterate that CLABSIs, while they are common in the ICU, we need to really focus on how we can decrease the CLABSI rates, and that's really important, especially in the pediatric ICU. These kids are so sick. So in addition to being immunocompromised, they do not need an infection to fight. And so this is just a way, using the Six Sigma method that we've learned in school and the cost-effective analysis to further dive into how we can decrease CLABSI rates, decrease healthcare costs, and ultimately improve the patient safety and healthcare outcomes.